Hey everyone, my name is James Hamill, and in my presentation today, I'm going to be focusing on anemia and exercise. Specifically, I'm going to be looking at iron deficiency anemia. I'll cover how anemia affects the body, how it alters the exercise response, and how exercise can actually help in managing the condition when approached in a safe way. I'll also include a case study to tie everything together in a practical, more example for everyone. On to the next slide here. So what I will be covering today, here's like the outline of what I'm going to be going over for the presentation. I'll start with what anemia is, and then go on to its types, and then its prevalence, and then explain the pathophysiology, how it affects the oxygen transport and energy production. After that, I'll go into how anemia changes the body's response to exercise and how exercise can also just help people with anemia. I'll then present, once again, a real world case study, an example, and finish with an exercise prescription with a fit principle and safety guidelines with the supporting research. So for the defined anemia, is defined as a condition where red blood cells or hemoglobin levels are too low to meet the body's oxygen needs. There are several types, but I'm focusing mainly on iron deficiency anemia since it's the most common type of anemia throughout the globe. And then other types of anemia can include, as I have listed here, vitamin B12 deficiency anemia, and anemia of just chronic disease. And iron deficiency anemia specifically impacts oxygen transport and exercise performance. On to the next slide. Anemia roughly affects 1.7 million people worldwide, and it's especially more common in women, children, and other older adults. And for athlete standards, it's more prevalent in like endurance athletes. Risk factors include low dietary iron, chronic blood loss such as like heavy menstruation, vegetarian diets, and chronic diseases. Athletes, especially females, are more susceptible due to the increased iron loss through like sweating and higher oxygen demands during their training. So iron plays a huge crucial role in forming hemoglobin, the molecule that carries oxygen in red blood cells. When iron levels drop, the body produces smaller, pale red blood cells that carry less oxygen, and this ends up leading to fatigue, shortness of breath, and reduced endurance when training. And on a more like cellular level, muscles have less oxygen for oxidative metabolism, which impairs aerobic energy production and performance capacity. Anemia directly lowers VO2 max and the body's like whole ability to use oxygen during the exercise. And then with less oxygen, the heart has to work harder, raising your heart rate and perceived exertion even at like a moderate intensity. And fatigue sets in usually faster, recovery takes longer, and dizziness or a lightheadedness can usually occur in anemic patients. Studies show that anemia can reduce VO2 max by up to 18%, highlighting its like the major impact on endurance performance, which why it mainly hinders endurance athletes, as I said previously. And how exercise impacts anemia. While anemia limits like exercise capacity, moderate and well-structured exercise can actually help recovery. Regular aerobic training improves cardiovascular efficiency, plasma volume, and the density of the mitochondria. And combined with like a proper iron therapy or like iron training, it can stimulate more red blood cell production and boost the VO2 max by up to like 7 to about 18%, according to the Hinton and Sinclair's research. The key is just balancing exercise with treatment and proper rest and recovery. So for my case study, I have Maria, and she is a 32-year-old recreational runner. She's been experiencing fatigue, dizziness, and lower endurance for her performances. Her medical history includes heavy menstrual bleeding and being on a vegetarian diet, both usually common contributors to iron deficiency. And then her labs show low hemoglobin, hematocrit, and ferritin, confirming that she is has iron deficient anemia. And then our goal, or her goal, is to restore her iron levels and get back to her usual running routine and be safe in about it. So for the exercise testing, I'd start out with a more sub-max treadmill test, and she's getting lightheadedness and has a lot of fatigue pretty early on. So I would probably do like a treadmill or a cycle test to like estimate her aerobic capacity without overexertion. And then I do like a 6-minute walk test, preferably, so she's not straining herself too much. It's a useful way to measure endurance and recovery. And then I monitor her resting and recovery heart rate, blood pressure, and perceived exertion pretty closely. And these tests establish a safe baseline while preventing excessive cardiovascular strain during the exercise testing. So moving on to the FIT principle, for her program, I have her frequency being roughly 3 to 5 days a week. The intensity starting at around 40 to 60% in the heart rate reserve, and then slowly progressing up to 65, 75%. And for the time, I'd probably do around 20 minutes and then work our way up to maybe 30 and then eventually 40 minutes for exercise. And then the type of exercise I'd be having her do is low impact aerobic activities like walking or cycling so she doesn't get fatigued too fast, and then plus just light resistance training around probably twice a week. And then progress, like I said, it's going to be gradual, week by week, increasing the duration before the intensity to ensure she's completely safe when she is going to those more intense exercises. So for the more safety considerations and what you might have to modify, safety is crucial for someone with anemia. So I keep workouts at a low to moderate intensity and use RPE scales to kind of avoid overexertion. So she could tell us on a scale of 6 to 20, 6 being the easiest thing she's ever done, 20 the hardest thing she's ever done. And somewhere in that scale, we could figure out how intense she's going based off the exercise. And then hydration is definitely a huge one. Proper recovery and nutrition are definitely key. I would avoid exercising in really hot environments to monitor symptoms like dizziness or unusual fatigue. I'd also recommend just rechecking your hemoglobin and ferritin levels every month to 2, 4 to 8 weeks to ensure progress without any real setbacks to her recovery. And then for her medications and supplements, most patients with iron deficiency use oral iron supplements such as a ferrous sulfate, often with vitamin C to enhance absorption. Some may need intravenous iron if they can't absorb it orally. And then some of the side effects for the GI side effects might include temporarily reduced comfort during the exercise. That's pretty common with the side effects. And then over time, the iron therapy usually restores oxygen delivery, improving endurance and reducing the quick fatigue during her workouts. So the supporting research and data, research strongly supports the link between iron repletion and improved exercise. performance. For example, Kapoor found VO2 max improvements of around 2.35 milliliters per kilogram a minute in women after like supplementing iron, and Bristert showed a 38% increase in endurance after iron therapy. And Hinton and Sinclair reported up to 18% of VO2 max improvement in female athletes. So all these studies help show that iron supplementation or iron therapy not drastically, definitely improves people's abilities for exercise, especially in anemic patients. So the rationale behind like my prescription and what I decided to do is my exercise plan prioritizes a more gradual progression to match Maria's low oxygen tolerance. Using the low impact exercise minimizes risk. So while resistance training supports muscle strength, research confirms that reestablishing that iron balancing improves like aerobic capacity. So by regularly monitoring symptoms and lab results, this prescription ensures like a safe way of exercising while also promoting a steady gain in performance over time for Maria. And lastly, for the summary, to summarize anemia and iron deficient anemia altogether, it impairs oxygen transport and reduces exercise capacity. So, however, when combined with proper medical and nutritional therapy, exercise plays a vital role in the recovery. With gradual progression, careful monitoring, and a nice balanced plan, patients can safely regain endurance, strength, and a quality of life. And last but not least, these are my main references for supporting my presentation today. They include studies and reviews that explore iron deficiency, its effects on exercise performance, and the improvements seen with supplementation and structured programs. And that is all. Thank you.